Oftentimes, predicting a heart attack is nearly impossible for physicians. However, research coming out of Spectrum Health Medical Group may make predicting and preventing heart attacks more of a reality. We're here with Dr. Ryan Mader. Can you tell us a little bit more about that?
Sure. So we've known for decades when patients die of heart attacks that the most common cause is that they've accumulated a large deposition of cholesterol or lipid within their arteries, and it's that lipid in the wall of the artery that actually causes the heart attack. And one of the limitations in our ability to predict those events is that we've never, until recently, had a tool available to us that we can use clinically to identify those areas of lipid accumulation in the arteries. And so now for a couple of years at Spectrum, we have had an imaging catheter that allows us to find these collections of lipid inside the artery. And we think we may be able to use that information to predict the patient's risk of having a future heart attack.
That's really impressive. How will this affect a patient's care?
Yeah, right now we're offering this as something that's available to patients when they come to the cath lab, that we can image their arteries to look for these areas of lipid accumulation in the vessels. And when we find them, that right now helps to tell us what a patient's risk is. Through research that we've done at Spectrum, we have found that for those patients that we find a lot of lipid present, that they are at a much higher risk of having future problems like stroke, heart attack, and death. And so it allows us to give the patient more information about what their future risk truly is.